Welcome to the drug policy discussion at this year's Friedman conference. Thank you to Tim and the ALS for inviting me to come and host this. Last year when I came here, Students for Sensible Drug Policy Australia was a brand new organisation. We'd existed for 4 months, pretty much in name only. And it's exciting to be back here this year and talk about what progress has happened and what we've been up to over the last year. So my name's Ash Blackwell. I'm the Vice President of Students for Sensible Drug Policy Australia. Our organisation exists to support students in tackling issues around drug policy on their campus and involving them in the political process to campaign for the kinds of laws that are relevant and effective and matter to them. Drug use as it exists in society is like predominantly a youth issue. Most people try drugs in their youth, and most people that use drugs are in their youth. Particularly around university, this is the kind of time where people might be experimenting and they might not have access to the kind of safety information that might be useful for them. So we also provide support for that kind of thing as well. So we've got a pretty busy panel today, so I'll kind of just give you a brief rundown of how we came to exist and who we're working with in the space, and then I'll bring it to the speakers, and we'll have some time for Q&A at the end. So for those of you who have the Hoover app, you can enter some questions in there, or we'll have a mic available at the end. So I've been involved in drug policy campaigning for about 5 years, out of concern for an environment that saw people close to me in my life kind of making some of the same mistakes that I made in my youth, like smashing the bongs a little bit too hard, maybe not making the most sensible decisions. And the message that was getting sent to them was still the same old tired message of don't do drugs, which doesn't really make much sense when you're already doing drugs. And I was like, oh, well, there's a whole bunch of stuff I could say that helped me to be able to manage my life when I was going through that. And so I started looking for other people that were doing stuff. I got involved with the Drug Law Reform Party, ended up running as a candidate last year in my local seat and kind of bringing the discussion to there. But after sort of working with some people in the space for a few years, we kind of kept looking for the student organisation. Students are good activists. They're people that are, I guess, not burdened by cynicism, perhaps. Like they're the kind of people that might be inspired to actually get involved in something. And so I started speaking to some students that I knew that might be interested in getting involved in this. And at the screening of a documentary at the end of 2015, I met or kind of reconnected with the president of SSDP Australia, Penny Hill. And we kind of had to sit down and said, oh, hey, well, do you want to maybe start this national organisation, and we'll see if we can help maybe coordinate and inspire some activism around the country. And she said yes. So for the last year, and then Chloe came on board a few months later, and for the last year we've kind of been on this crazy learning curve of creating and fulfilling the promise of an organisation at the same time, which was quite a learning curve for us, because in terms of organisational governance, they're not the kind of skills that any of our executive, except when Margie came on board, have a depth of knowledge with. So, you know, last year at the Friedman conference, we were having a web design meeting out the back to like get a website designed, and it was the most hilarious thing. If you can imagine 3 people that know nothing about IT trying to design that kind of thing. So over the year, what we found predominantly, and I guess one of the main messages that I want to present today, is we've had nothing but support. Every time we've had an idea or wanted to do something or spoken about doing something, we've had support from the student body, we've had support from political parties across the spectrum, yes, pretty much all of them, and we've had support from academia and professionals like the gentleman to my left, who have been doing stuff in this space and writing the policy documents that we look to inform us. Right now, Students for Sensible Drug Policy Australia has 5 affiliated chapters at universities across Victoria and New South Wales. We have students that have clubs at, I can show you some photos. I did actually bring these up. So, it's not very good, but so this is our Deakin chapter at O Week this year. And actually, the president of the Deakin chapter I met when I went out and spoke to the Victorian State Branch meeting of the Liberal Democratic Party. So we do have some libertarians in our movement, although we are apolitical. And I think that's one of our strengths. It means that we can appeal to a broad range of coalitions, and that's one of the things that we've had a lot of success doing in the last year. We've networked internationally. Students for Sensible Drug Policy has existed in the United States for nearly 20 years now. They also have a presence in Canada, the Ireland, the United Kingdom, Africa, and parts of Europe as well. So we've managed to create this broad network in the last 12 months that kind of reaches internationally, sending students to several international conferences, including the United Nations General Assembly Special Session on Drugs last year in New York, and various harm reduction conferences internationally. We've also started to draw connections between academics in different universities and provide a pathway of access for students that want to talk about these issues to be able to find the experts to help them do that a bit easier. Sorry, I was saying where we have our chapters. We also have chapters at Deakin University, that was our first university, Melbourne University down in Victoria, and La Trobe and Macquarie up here in New South Wales, with students actively working in about somewhere between 5 and 10 other universities. I can't keep track. We have different people managing different states at this stage. So some of our core campaigns that we've had some success on, probably our signature campaign has been around the issue of pill testing. And this is, I'll assume maybe that you guys have some basic knowledge about what that is. It's essentially a way that people can have their substances tested absent of any prosecution or criminal inquiry into that, and then they can make a decision based on actually some information, as opposed to in the illicit drug market where you might be making decisions devoid of any information. So you might not know the contents of your substances. And as we've seen in the last several years, there's been a spate of deaths at festivals from adulterated or misrepresented drugs. So we have been working, the Melbourne University chapter kind of took the lead on this, and this has been one of the most exciting things for me, is seeing students kind of run with this idea, and now they're just doing their autonomous things that we don't even always know what they're up to, which is kind of that was our aim and goal, was to really empower leadership in the different universities. So the Melbourne University chapter has pioneered what's pretty much a world first program of working with the student union and the university to deliver reagent kits, which are kind of an elementary tool where you can get some information about the substance. And that's probably going to be rolled out soon. It was also taken by some of our members to the National Union of Students, and they adopted it as policy. So it's possible that the student unions around different campuses might become a distribution model for this campaign. We've also campaigned on issues of injecting, safe supervised injecting facilities and legalization of cannabis and these kinds of things. I could talk for a very long time. That's a little bit of a sort of brief summary of our organisation and what we're up to. If you want to follow us, we have a Facebook page. We've got a table out there, and I'll be available all weekend to answer any questions that you might have. So I'll pass it on to our first speaker. I don't know, how could I describe him? I could spend a lot of time sort of ticking off his credentials. Dr. Alex Wodak is one of the leading drug law reform experts and advocates in Australia. Helped set up the first needle syringe program in the world, which has kept HIV rates in injecting drug users in Australia under 2%, which is something that hasn't been achieved anywhere else in the world. He helped set up the National Drug and Alcohol Research Centre, was the head of the St. Vincent's, you might have to correct me on that, Alcohol and Drug Service for 30 years, recently retired, and he's the head of the Australian Drug Foundation. He's going to talk to us today about some human rights issues and drug use. Could you please make Dr. Alex Wodak welcome? Once I get his slideshow up. Here we go. Which one do I click? Slide sorter? Is that it? That one. Thank you, everyone. See what I mean about the tech stuff? Okay.
Well, thank you very much, Ash, for that introduction. And thank you very much, Ash and Chloe and Marg, for the work you're doing for Students for Sensible Drug Policy. And thank you all for coming along. Now, I'm going to be talking about different reasons for supporting drug law reform, and in particular, the reason I'm going to talk about today is the unfairness and the injustice of majorities punishing people with minority drug preferences. Now, I want to start by acknowledging the work that Milton Friedman did a long time ago in his contribution to drug law reform. He wasn't the first person to advocate major drug law reform, but he advocated at a time when he was in a very tiny minority. He was President Reagan's economics advisor. He wrote a famous letter to President Reagan in Newsweek about the need for drug law reform. He was outspoken on the issue. He was way ahead of his time. And those of you who haven't looked at things he said, there are wonderful quotes of Milton Friedman's on the need for drug law reform on the internet. And one thing is very clear, and that is that he really got this issue. And so it's right and proper that this conference continues to show an interest in the need for drug law reform. Sad to say, we haven't, despite all the discussion, and that you've heard a bit from Tim about this as well, in terms of actual advancement, we haven't really advanced all that much from Milton Friedman's day. Now, the three main arguments that people use for talking about drug law reform, and the first argument is that our current drug policy has failed, and it's failed in several respects. It's failed to achieve its objectives. This is a harder argument to pursue than you might think, because the proponents of drug prohibition were always careful to never say exactly what the objectives of drug prohibition were. So it's hard to say that they've failed, but by any test of being reasonable, it's clear that drug prohibition has failed. And it's failed in two clear respects. Firstly, the drug market has continued to expand, and it's become also not just expanded, but it's also become much more dangerous over time. And even more important than that, the outcomes from drug policy have become worse and worse. And these are things like increasing numbers of deaths, disease, crime, corruption, violence, even threats to national security. So it's a failure in terms of markets and outcomes. It's also a failure in terms of the severe unintended negative consequences of this policy. And these are self-evident. And in a third way, it's also clear that it's cost ineffective. It's turned out to be an expensive way of making bad problems even worse. That's really the first set of arguments that's used to argue for change. The second set of arguments is that there are better ways of managing drugs than to enforce drug laws. And essentially what is being said here in different ways is that we should be redefining our approach away from a criminal justice-dominated approach to one which is primarily based on health and social interventions. Secondly, that these would need to be funded properly. At the moment, the bulk of the funding, 66% of Commonwealth, state and territory funding in this country allocated to responding to drugs goes to drug law enforcement. Only 21% goes to treatment, 9% to prevention, 2% to harm reduction. And it's the smaller amounts that actually do most of the heavy lifting. The drug law enforcement does surprisingly little. Thirdly, we should be reducing the emphasis on punishment by reducing the penalties and also reducing increasing the thresholds at which these criminal laws start operating. And fourthly, and most difficult of all, is that we should start regulating as much of the black market as we can. At the moment, the regulation of the market is left to the criminals, and ultimately the state has to start taking as much of that over as possible. Now, these are the standard arguments for drug law reform, and they are sound arguments, and they are getting increasing traction. But they're based on the assumption that the drug laws are fair and just. And I think we really need to question that. We really need to ask ourselves, would we still support drug laws if they were effective and if they were the best way of managing the problem, if we thought in our heart of hearts that these laws were unfair and unjust? And I hope, if we considered that the laws were unfair and unjust, I hope that this would make us reconsider our commitment to drug prohibition. Now, I think there are a lot of parallels between the criminalisation of drug use and the criminalisation of homosexuality. Let's mistake on the first line, take our minds back to 1895 when, it says 1995 there, when Oscar Wilde was given 2 years hard labour for having sex with another man. 1952, Alan Turing was given a choice of sentencing options when he was found guilty of having sex with another man. And he was given the choice of going to prison or taking estrogens. He took estrogens and couldn't cope with the changes to his body that the estrogens made, and ended up injecting cyanide into an apple and committing suicide. For those of you who don't know who Alan Turing was, he was responsible for decoding the Nazi code, secret code, using the famous Enigma machine, arguably shortening the Second World War by 2 years, saving, so it's believed, 14 million lives in the process. And he was also made a major role in contributing to the development of these guys that most of us now possess. So he changed our lives for the better in huge ways. And here he was, criminalised and punished in the United Kingdom. And that led in 1957, so it's believed, to the establishment of the Wolfenden Commission. And in their report in the United Kingdom, they recognised they recommended that people who have consenting sex with other adults in private, people of their same sex, should not be punished for it. And it took a long time before the UK got around to civil partnerships in 2004 under the Blair Labor government, and then under the Cameron Conservative government in 2014, the British finally achieved marriage equality, which unfortunately we are yet to achieve. Now, a lot of parallels I would put to you between what we have done in many countries to criminalise and to punish people with minority sexual preferences, and the punishment of people who have minority taste in drugs but aren't harming anybody else. If they're harming anybody else, if they're robbing a bank, of course, we don't want people to rob banks. We don't want people to be violent to anyone else. Anyone who does that should be punished. But absent harm to others, why should the majority punish people who have minority taste in drugs? And so I put it to you that really is the most fundamental objection that I think that we should all have to our current drug laws. Now, this is a line of argument, frankly, that doesn't appeal to many people. in the community. It appeals to a lot of lawyers, but apart from lawyers, many people don't really get that our laws really should be fair and just. If you think about it, though, it's a big deal when the state punishes its citizens, and in every country in the world, there's a strong commitment to doing that properly, to make sure that the parliaments or legislatures pass the right laws in the first place, that the judicial system carefully considers each individual case and makes sure that the guilty are punished and the innocent are set free. There's a lot of emphasis in all our legal systems, all of our different kind of communities around the world. And yet here we are punishing people because they're taking the wrong kind of drug, even if they're not hurting anybody else. So some people put this argument out as saying that we have a right to take drugs. Now that's got even less traction than the line of argument that I've put to you about the unfairness and injustice. So each of us has to make our own decisions about whether we try and argue in ways that we know are more likely to persuade people, or whether we argue things that we feel more passionate about. But I think this is a very important part of the arguments for drug law reform, and I'd urge you to consider that. Now, it's slightly different in the United States, where there is a Bill of Rights. Many other countries have human rights acts. It's easier to argue this third strand of argument in those kind of countries. But Australia has weak protection for human rights, and it's even harder in Australia to get across this argument that a major criticism of our current drug laws should be that they are unfair and unjust. So I know we haven't got a lot of time. I hope that we'll have a lot of questions and answers, but I think we can take a lot of encouragement from the fact that there is growing support for drug law reform in Australia. In a review carried out by Essential Media and Communications last September, 55% of Australians now support taxing and regulating cannabis. That's only about 5% less than in the United States, and that poll hadn't been carried out before using those words, but clearly that view is strengthening, that cannabis should be taxed and regulated. That's getting more support. Most of the increase in support that we've had in recent years has been due to these arguments that our current drug policy has failed. More and more people are saying this now. Yesterday, the New South Wales Police Minister, Troy Grant, who's a former policeman and is a very strong advocate for our current drug laws, conceded that our current drug laws are not working. And 3 years ago, the then Prime Minister Tony Abbott said the war on drugs is the war that we cannot win and is a war that we can lose. So we are getting more and more traction around this issue. But I think we do need to encourage more and more people to the view that even if the laws worked, they are unfair and unjust, and on those grounds alone, we should not be supporting them. There's been considerable advocacy for drug law reform in Australia for 30 years. Despite that, there's not a lot to show on the ground for in terms of change of policy. There has been some change in policy. We have a different situation in this country compared to the United States. Philanthropy is pretty weak in this country, and it's very difficult to raise funds for this issue. Nevertheless, I think in many respects we've won the intellectual debate, but the intellectual debate has to be followed by winning the political debate, and that's much more difficult than winning the intellectual debate. I think we need to be careful which arguments we use, and we should use the arguments that are going to most rapidly bring about change, because the current situation is causing too many deaths, too much disease, causes a lot of crime, and costs a fortune. So thank you very much, and look forward to your questions.
Thanks, Alex. I'll just very briefly say I had the pleasure of being invited to the Students for Liberty conference down in Melbourne to talk about the issue of cognitive liberty. I think it's the ideas around personal rights and the freedom of conscience, the freedom of your own mind, they're kind of natural arguments for libertarian-minded people. Other countries, as Alex was saying, have certain human rights laws that make those arguments a lot more accessible. So in the United States, you've seen around particularly the psychedelic use and spiritual use of some drugs has been legalized. Typically, that's the human rights argument that's used and been successful with some of these cases. So you have churches in the United States where people have the freedom to use magic mushrooms, psilocybin. You have the Church of Santo Daime in South America, where people can use ayahuasca, a traditional psychedelic, for spiritual enhancement. But the point that's really interesting in the cognitive liberty argument in like an international legal sense is Mexico. I think it was about 2 years ago, 4 people brought a human rights case to the Mexican Supreme Court and it was on the grounds of freedom of conscience, like cognitive liberty. That was the specific argument that they used, and they were successful in that. So 4 people in Mexico, I think 1 or 2 of them that don't even smoke cannabis, now have the legal right to grow and smoke their own cannabis. It's a small win, but in Mexico, I am aware that there's some legal groups and drug law reform activists that are looking at pushing that issue further. So I think it's a particularly interesting human rights case. So thank you, Alex. Next speaker that we have today is Dr. Colin Mendelsohn, one of Australia's leading tobacco addiction specialists and a vocal advocate for vaping. It's an issue myself that I kind of came around to very slowly. I wasn't really sure what to make of it, but I'm convinced that it has the potential for improving public health, probably more than any other aspect of drug law reform. So thank you, Colin.
Thank you, Ash. Just need some slides.
Oh, God. The tech thing again.
Yeah, it's here somewhere. So we'll get rid of that
Hang
one.
on. I'll just get it up for you here. Yeah, this one.
That one, yep, great.
There we go.
Okay, so hi everyone, thank you for coming along to hear about me talk about my favourite subject. As you'd be aware, electronic cigarettes in Australia are a very contentious issue. We have 2 camps vigorously and passionately opposed to each other with their views, but this is all based on the same evidence base. We have a whole lot of evidence now, and people are looking at the evidence in different ways and interpreting it totally differently. And this presentation is about trying to make sense of that. How are we looking at the same evidence and coming up with totally opposed views? I have no conflicts of interest, just to declare that up front. So just to clarify for those of you who aren't users, and I know there are a number of vapers in the audience, but electronic cigarettes basically consist of a battery and a little chamber of e-liquid, which is a liquid which may or may not contain nicotine. And when the user breathes in, the little heating element in the end of the vape lights up and heats up the liquid and vaporises it into a mist, which is inhaled into and absorbed through the mouth and the lungs. And then the vapour breathes out a visible cloud. So this very much simulates smoking. So basically, you're getting the nicotine that smokers are addicted to, that they need, but as well as that, you're simulating the smoking habit, which is a very important part of the addiction. So people get the behavioural ritual of smoking, the hand to mouth, the blowing out of a cloud, the sensory aspects of smoking, the taste, the feeling of the smoke going into your lungs and so on. So it's basically replicating smoking. So we're talking about tobacco harm reduction. So traditionally, the approach of people in tobacco control has been all about people have to quit, abstinence only. And we've had that model running for many years as the only way of approaching smoking. And this is otherwise known as the quit or die approach, which obviously works if you quit, doesn't work too well if you die. But the problem is that smokers are repeatedly trying to quit and being unsuccessful. And we all know that smokers repeatedly make attempts to quit and relapse. And this goes on and on repeatedly for many years in each smoker. Tobacco harm reduction is a new paradigm. And it's the option of giving people another option where if you can't quit, switching to an electronic cigarette gives you the nicotine that you need and also gives you the behavioural, the smoking experience. So it's a safer alternative to smoking. And it's no different to other harm reduction strategies that are currently being used and are widely accepted, where we accept that people can't change certain behaviours or don't want to, but we want to reduce the harm to health. And that's the basic principle. Letting people do what they've chosen to do or what they can't stop doing, but the most important thing for public health is to reduce the health risk. So what's the evidence for vaping? Well, there have been several major independent reports from very highly respected international organisations, starting with Public Health England, a major report in Canada earlier this year, another report from England, and a report from the Royal College of Physicians, a comprehensive review of all the evidence last year. And what all these reports have accepted and agreed on is that vaping is an effective quitting aid, so the use of an e-cigarette does help people to quit, and we know millions of smokers have quit using e-cigarettes. We know it's substantially safer than smoking. We've got a very small fraction of the toxins in tobacco smoke are in vapour, and those that are there are mostly less than 1% of what's in concentrations in tobacco smoke. We know that the harm to bystanders from second-hand vaping is minimal. We know that these products are used almost exclusively by smokers and recent ex-smokers. So uptake by children and non-smokers is actually rare, and we know that from national studies in many countries. And the evidence is so strong that the Royal College of Physicians in the UK has concluded that in the interests of public health, it's important to promote the use of e-cigarettes as widely as possible as a substitute for smoking. So that all seems pretty straightforward. The evidence seems pretty convincing. However, there is quite a lot of opposition to e-cigarettes. In Australia, the opposition is unanimous. Our 9 health departments are opposed to e-cigarettes, our peak medical bodies are opposed, our public health organisations, our medical associations are all opposed to e-cigarettes, advising great caution. Internationally too, there's also lots of opposition. The World Health Organisation is opposed, the Surgeon General from the US is opposed, although he's just recently been fired, but that's another story. But what people who oppose e-cigarettes generally, when you look through their position statements, they're basically framing e-cigarettes as a risk. So they're looking at the threats associated with e-cigarettes. That's what they're focusing on. What is the risk of this new technology? So, yes, of course, e-cigarettes are not harmless. Nothing is harmless. And there are small risks. And they're focusing on small risks. They're focusing on potential risks and unknown risks in the future. What's going to happen in 20 years' time? We might find that people grow horns and a tail from using these things. Well, that's true with any new treatment. You never know in 30 years' time, but we can say from what we know that the risks are likely to be far safer than smoking. They worry about these products enticing young people who don't smoke to start vaping, become addicted and move on to smoking. They worry that widespread use of vaping will be seen as making smoking more socially acceptable again in the community. And they're worried this will undermine tobacco control. So we've done a lot of good work making smoking uncool. We don't want it to start looking cool again. And they're worried about big tobacco. Big tobacco has behaved disgracefully over the years, as we all know. And there's this kind of view that, well, anything big tobacco does must be bad, so we need to oppose this based on that principle alone. So basically, this is a risk-averse precautionary view. So they're saying, well, there are risks. Let's look at these risks and dangers, and we don't want any new risks to be brought into the equation. The people who support e-cigarettes are generally looking at the opportunity. So they see a huge potential benefit to public health. So we know that many smokers are unwilling or unable to quit smoking. And we know that up to 2 out of 3 of those will die prematurely as a result of their smoking. On average, they'll lose 10 years of life if they continue to smoke. We know that e-cigarettes work, and we know they're popular. In the UK, in the US, they're the most popular quitting aids, more than patches, more than anything else. So people like them. They have a wide reach, which is important to be effective. And we know they've helped millions to quit. This survey from the EU that's quoted here estimated that 6 million smokers in 2014 had quit tobacco using e-cigarettes. 6 million people. That's 4 million lives saved right there. So it seems like a no-brainer if you're looking at it from an opportunity point of view. Just to clarify the legal status in Australia, the devices themselves and the juice that's used in them without nicotine are legal and approved, and you can purchase those freely. But once you start introducing nicotine, which of course is what the smokers need, you have problems, because nicotine, it's illegal to possess and use in Australia. Now, that's based on our national poison standard, which is our poisons categorisation. It's regarded as a dangerous poison. But what's extraordinary is the poison standard specifically exempts nicotine in tobacco. So you're not allowed to use low concentrations of nicotine to help stop smoking, but you are specifically allowed to use nicotine in combustible tobacco, which is the most lethal consumer product ever invented. So I think that speaks for itself. And Australia is increasingly out of step with other countries. Other peer, affluent, industrialised countries are mostly moving in the other direction. So in the UK, the United States and the European Union, there is support, and e-cigarettes are legal and they're regulated. Recently, New Zealand and Canada have started to legalise and will go on to regulate e-cigarettes. So Australia is very much out of step with the momentum, and very much out of step with our partners with similar countries and values. So the question is, why? We're all looking at the same data. Why are some people interpreting it this way, looking at the risks? Others are looking at the opportunity and taking it forward. So first of all, why do people have negative views? So I wanted to get inside the brains of some of the public health, tobacco control and health department people who are making these decisions. Why are they taking this negative view? I think the most important issue is that they've used a framework, an ideological framework, for about 40 years to fight tobacco. And that framework has no room for tobacco harm reduction. Their approach has been complete abstinence, complete elimination of tobacco, nicotine, tobacco companies, cigarettes, and that's the only way they've approached this issue. And they've devoted careers to eliminating tobacco. And here we are again with a product that looks like smoking, which is partly why it works, and this is creating a whole lot of resistance, because their framework does not include harm reduction, and this is a whole new threat because it's threatening the way they've always done things. The other concern they have is big tobacco. So, yes, look, big tobacco has behaved disgracefully, but that doesn't mean everything they do now is automatically bad. But people who have campaigned against big tobacco all these years, some of them are saying, well, they can't possibly be part of the solution. We don't trust them. They've done so much wrong before. They can't possibly help us to resolve this problem, whereas in fact they actually are. For them, there's an advantage. If they're going to lose smokers anyway, they may as well shift to their brands of e-cigarettes. So they actually are part of the solution, I believe. Another reason behind these negative views is, amongst public health, this is a threat to the status quo. This is not the way we do things. We've always done it a different way. And also, we didn't think of it. So that's really annoying, because this is a really effective method that someone else thought of and they're imposing on us, and we're the experts. So we don't like it. If we'd thought of it, that would be quite different. There's not a lot of sympathy for smokers. There's this view within public health that smoking is sinful. It's a weakness. They should just bloody stop. We've been telling them for years, what is their problem? And the other problem is that vaping's actually enjoyable. And the pleasure police have really been distressed about that. So people are using an addictive drug and actually enjoying it, and you want us to legalise this? So it goes against everything they've stood for. So the view on vaping within some of these organisations is a shared belief, and it's supported by peer pressure and supported by arguments against the alternative narrative. So they together acknowledge that this is the way we do it. If you're going to stay with us, you basically have to follow our narrative. And there are consequences for not doing that. So you get less funding for research, there are career and status repercussions. So these are other reasons when you're in this particular place and this mindset within those organisations, it's very hard to change. And finally, nicotine over the years has been demonised because of its association with tobacco and because it's the addictive ingredient in tobacco. So unfortunately, nicotine has got a reputation it doesn't deserve. It's a relatively minor product, minor chemical in terms of health effects. But it's what kills people is the tar, the carbon monoxide, all the other poisons of combustion, not nicotine. That's relatively minor. So these people have made up their minds about e-cigarettes and tobacco harm reduction already. And the problem is that once you've made up your mind, it's very hard to change. And you tend to see evidence that supports your beliefs and accept it on face value. Evidence that contradicts your beliefs, you oppose. And I think these opinions are very hard to shift, even when the evidence changes. So people interpret the evidence to support their underlying belief. Now, we all do this, of course, but I think this has a large part of the explanation for what's happening in this space. There is a solution, and the solution is a compromise of both of these positions: to legalise nicotine in low concentrations and encourage smokers to use it, to change, but also have a portfolio of regulation which is balanced and proportionate to risk, to minimise any harm to bystanders and also safety and quality standards, no sales to young people and so on. So you can regulate to minimise the risks that our opponents are concerned about. So finally, I think we all just need to take a deep breath and calm down and look at the evidence. Attitudes and policy should not be based on ideology or on outdated beliefs. There are millions of lives at stake here, and I think it's too important to get this wrong. Thank you.
Awesome, thanks, Colin. It looks like one of our speakers has not managed to make his way here. The intention, is that Adam? Oh, he is here. Oh, okay, cool. Okay, hang cool. I'll just, so what I was going to do is play a video from the leading market analytics company in the cannabis space in the United States to maybe paint a bit of a picture of how the market's shaping up and how it looks over in the US. And then we're going to come to Adam, who's an entrepreneur here in Australia, who's started a company to explore how he can work with other people and other stakeholders in the cannabis space. So it's a bit of a long video, and I do want to allow time for Q&A, so I'll let it run for a minute, but I might cut it short and then post the link in the Hoover app and make it available for anyone that wants to watch it later. So we'll go to Troy from ArcView, who's going to talk about the $21 billion cannabis industry in the United States. I am going to pause it there. My apologies. If we don't jump to Adam, we won't have enough time for Q&A. So I'll make that video available. I'll put it in the Hoover app and put it in our Google Drive so you can come and ask me for access later. Adam is the founder of BuddingTech, a company here in Australia looking at technological solutions in the cannabis market. Please make him welcome.
I can use the microphone? Excellent. Yep. Thank you so much. Yeah? Hold on the side. Yeah, great. Hi guys. So
as was mentioned, I started a company called BuddingTech, and our objective in 2016 was to encourage the development of the ancillary industries around the medical cannabis markets and to look at how the federal legislation had developed to kind of suit a very pharmaceutical style industry and kind of understanding how entrepreneurs could take advantage of that. But before I get further into that, I'll kind of take a look at what's going on around the world in the medical cannabis market. So the country that we often most refer to, Israel, has recently increased its patient population to 27,000. In 2012, there was only 10,000 patients, so it's experienced an exponential increase in growth of patient population. And additionally to that, they've also recently created legislation to open up the export market. So they've started to explore the science. In fact, not even started, they're well into the process of exploring the science, and now they're creating federal legislation to allow for exportation to a global market. In Canada, the patient population this year increased by 227%. In America, there are more than 27 states that have a medical cannabis program in place, but as Troy just mentioned, unfortunately, because there's a federal issue with cannabis use, it's in a state of flux, so nobody really understands how the industry is going to grow there. In Germany, most recently, the country allowed for medical use for different patient groups, specifically with multiple sclerosis, chemo-induced nausea, and it's quite a success because Germany is going to be, in my view, quite a powerful country in the coming years because they've got a very, unique way of dealing with the legalization of cannabis, but I don't have enough time to kind of get into that. Another few interesting countries that have recently come out of the woodworks are South Africa. They've just recently passed legislation to allow for cannabis cultivation for medical use. And most notable is Argentina, which last month allowed for, as well, legislation to allow for cannabis use. But the most interesting thing about Argentina is they're developing a program next month which will allow patients to access medication for free. So they've just started working on this initiative. So kind of looking at Australia and where we're at. So last year, Australia, on the 24th of February, allowed for the domestic cultivation and manufacturing of cannabis. There was changes made to the Drugs and Narcotics Act. And in October, they rescheduled cannabis from Schedule 9, meaning that it is prohibited, to Schedule 8, meaning it is a controlled substance that can be prescribed by a specific authorized prescriber. This is really interesting because countries like the ones that I just described have taken a patient access first, legislation second model, whereas Australia has gone the complete opposite, which was something that you were saying, which is, Australia takes very interesting approaches to doing things, and if it's not their idea, they kind of try and make it in a way that it is, but they've gone down the path of developing legislation so that they can very much regulate the market. And in regards to opportunities, what it creates is a unique ability for Australia to eventually grow products for a global market. We did a study with the University of Sydney and a company called MGC Pharma. They're a ASX-listed company, and this was done in 2016. And one of the demographics that we created showed that if we were to look at 3 patient groups, HIV, epilepsy, and Parkinson's disease, there's a population of around 30,000 patients. And what we did was then compared the average cannabis consumption in Israel, Canada, and the Netherlands for those specific patient groups. We estimated a rough amount of 8 to 12 tons per year of cannabis, which would equal, from a global market, 150 to $200 million per year. If you look at the opium market in Australia, which is worth $300 million per year annually, you can see how cannabis has the potential to very much disrupt the industry. So there's a lot of resistance, but nonetheless, we do have an industry that's starting to grow, but very slowly. And some of the most, critical barriers to access right now is the fact that we don't have registered products available in Australia. But the government does have pathways to access unregistered products, which is the Authorised Prescriber Scheme and the Special Access Schemes. Now, there were 2 portals for the Special Access Scheme, Portal A and Portal B. Portal A was a simple notification to the government to say, we're going to be prescribing an unregistered product to a patient, and this was it. Unfortunately, Susan Ley, the previous health minister, the day that cannabis was rescheduled, made a discretionary change to Category A, now meaning that you can only go through Category B, which is a more lengthy and time-consuming process, which means you have to apply to the government, you have to wait for a response, you have to provide medical evidence, and you have to have a doctor that's actually willing to prescribe it. So it's a little bit problematic, and patients are finding it very difficult to access products. And then the authorized prescriber scheme, which is I'm a doctor, I'm interested in prescribing, I must find the medical evidence, I must prove that I have an understanding of the market and how this product works, and then I can apply to a particular patient group. So there's still a lot of hurdles. One of the things that we're going to be doing in the next few weeks to somewhat combat, or I guess assist with the developing industry, is an initiative called the Medical Cannabis Council. So we started working last year on developing Australia's first national body to represent the entire medical cannabis industry, and in the next week or so we'll be launching this initiative as a national body and as a non-for-profit. And the goal is to unite the supply chain across all the way from research and medical personnel up to distribution of products, so that we can have a consistent theme of message that we can then work with the government as opposed to butt heads with the government. So a lot of advocates right now are very disappointed, fairly so, but they're not offering solutions as to how we can address problems. So what we want to do is create a body that will be able to work with the government in order to assist them with the, I guess, major issues, which are education, product, and in my view, the legislation from the state and territory perspective not aligning with one of the federal legislation. So if you go to South Australia, you'll have different cannabis legislation to if you're in New South Wales, and that's somewhat ineffective and not practical. So what we're going to be doing over the next year is working with the federal government to align state and territory legislation so that there is a consistent theme across the country. So I don't have that much time to talk. I'll mention that BuddingTech, as I said before, we're interested to work with people who are developing projects in the space, whether that's entrepreneurial focused or research focused, and providing as much assets and resources that they need to build these products to help develop the industry. So with that, I'll say thank you, and I'm here to answer any questions if you'd like.
Excellent. Thanks, Adam. We've had some questions come through on Hoover. I'll just see if I can bring it up. One of the first ones was for the whole panel about what your ideal drug laws would look like. So maybe if we start with you, Alex. Do you want to just oh, you've got the mic? Yeah.
Thank you. Well, I think the first objective has to be to redefine our whole response to drugs as being primarily health and social. And once we make that threshold switch, a whole lot of things automatically happen. We're always going to have laws on the range of psychoactive drugs. We have laws on the legal psychoactive drugs, and when the currently illegal drugs have gone through some reform process, we'll still have laws. So at the moment, if you arrive at in Australia from overseas and we've got a suitcase full of alcohol that hasn't been declared, or cigarettes that haven't been declared, at large quantities of them, there'll be a punishment for it. I'm not troubled by that. And likewise, if you come to Australia with a suitcase full of heroin, cocaine in the future, I'm sure that will always attract some kind of official sanction. And how big that sanction should be and where the threshold should cut in will be debated forever. But I think the issue is that we should be moving towards getting the law out of that as much as we can. And I think what we need to do is to undermine that illegal market by a legal market. That really has to be the driving process in this. And it's important in this debate. It's often, a couple of things are often forgotten. It's often forgotten that the current system drives the market towards more dangerous drugs. More dangerous drugs drive out less dangerous drugs. Not many people realise that applies. Second thing that I think needs to be emphasised is before we had prohibition, we didn't have prohibition. Until 1906 in this country, in Australia, edible opium was taxed and regulated and sold in grocery shops. That was stopped in 1906. Until 1906, the Commonwealth Government in this country generated a revenue of £60,000 a year from the sale of of lawful edible opium. We'll go back to something like that. In the United States, until 1903, Coca-Cola contained cocaine. So we have been in an environment before in Western countries where drugs that are considered too dangerous were made available, but carefully selected types of those drugs were made available, and they were made available in smallish quantities in low concentration. That's where we need to find the middle ground. At the moment, where we are is that the whole market is left over to criminals, corrupt police, and outlaw motorcycle gangs, and that's to the detriment of people who use drugs and their families and the whole community. So that's the way we have to shift. Of course, there are a lot of very important detail in that, but I don't think we have the time to go into that right now.
Just before you do answer that question, Colin, I'll get you to take 2 bites off it here, because there was another one directed to you from Sam Bowman, and it was about whether you're optimistic about other reduced nicotine products such as heat not burn, in reference to some of the products coming out where they vaporize the whole herb of the tobacco. So maybe if you want to take a little stab at both.
Yeah, so just in terms of regulation, vaping products do need to be regulated, there's no question about that, and I think that's to minimise potential harms to the vaper and to the community. Currently we have absolutely no regulation, we have a black market without any controls and all the repercussions that go with that. So to protect the vapers themselves, we do need quality and safety standards, including electrical standards. It's very embarrassing when these things blow up. The risk of that can be reduced. We need packaging standards, we need childproof containers to protect children. We need, I think, to have responsible advertising so that, yes, they can be advertised to smokers to encourage them to switch. I think that's important. A minimum age of purchase, of course, to keep them away from children. And health warnings and so on. So I think regulation is important. And minimal taxation, I think also to encourage people to make the switch based on these being proportionately far less dangerous. In relation to heat not burn, I don't know if you know what they are, but basically all the big tobacco companies are making products that are concentrated nicotine that you put into a device, and when you puff it, the product, the little tobacco plug, heats up, doesn't go to the point of combusting, but it heats up and releases a vapour that's got all the flavourings of the tobacco. So these are regarded as about 90% safer than smoking, because there is no combustion. But it's probably not as safe as e-cigarettes, but much safer than smoking, and really that always needs to be our comparator. We're struggling enough as it is to get e-cigarettes approved in Australia, and I'm not pushing to have those legalised just yet. It'd be nice if it all happened, but I think the focus personally should be on getting vaping products approved, because that's really hard enough as it is. But I think these are another alternative, because some people who try vaping find it's not as authentic an experience as they would like, it's not close enough to smoking, and this is another option, and it's really all about options. So people can stop smoking altogether, they can vape, they can use heat not burn, and so on. I think we need to allow options.
Okay, so in regards to ideal drug reform, I'm not an expert on the topic, so I'm not going to comment on what I feel would be the most ideal solution. But what I will say is that referring to cannabis, which has been found to be, we still need to explore further and understand how the plant works, but there's never been a death in history attributed to cannabis use. I believe that there are other substances out there which are very much worth further exploration, specifically plant medicines. So I believe the appropriate sort of drug reform would be an inquisitive one to look into and understand other different types of plant medication, the medicines that are available, and seeing what type of solutions that they may offer, because a number of them are currently listed as Schedule 1 in America substances, which classify them in the same category as heroin and cocaine, which I feel is an injustice to society. So I would just encourage exploration of these substances, and ideally, that would be attached to government funding and support. So that would be my quick answer to the question, because I know we're limited for time.
Yeah, I think we kind of have to wrap it up. There was one more question that I'll just briefly touch on, and somebody asked about the prospects for reform. Well, we're the youth organisation. We're always hopeful. When I spoke to Fiona Patton from the Sex Party after she'd narrowly had a bill defeated to introduce a supervised injecting facility in Melbourne about 6 weeks ago, she did say that the support from the backbench within both the Labor, Liberal Party and the Greens in Victoria would have got it across the line if it was a conscience vote. But politics doesn't allow you to have a conscience, which I kind of want to get that on a t-shirt. But the support is there behind the scenes. So I think there are prospects for reform. As Alex said, the intellectual debate is over. Hopefully organisations like ours can help mobilise the political support so that we can get some things across the line. Please join me in thanking all of our speakers for today.